Well, one of the reasons this vote was so close was debate over the Stupak amendment. The amendment imposes tight restrictions on abortions that can be offered under a government-run insurance plan. It limits them to cases of rape, incest, or where the woman's life is in danger. And in the end, that amendment passed. But not before this heated exchange between Congressman Boehner of Ohio and Congressman Rangel of New York.
It's pretty clear that this could be a shell game that's underway. That it gets to pass here in the House, helping to ensure that this bill passes, but we have no guarantees that when this comes back from conference that that language, stopping taxpayer funding of abortion, will be in the bill.
Well, Leader Yale, all I'm asking, as long as you've been here, have you ever had any member...
Regular order, Mr. Speaker. Regular order. No time's been yielded.
Yield. Have you any... Do you remember when anybody...
Gentleman yielded back.
Oh, you do?
The gentleman from New York.
Have you ever got a guarantee like that from anybody since you've been here?
Well, speaking of being there, Republican Congressman Peter King spent a late night on the Hill, and he is joining us now. Congressman, good morning to you.
Good morning, Jamie.
There are many people who are pro-life who looked at the Stupak amendment, which is really similar to the Hyde amendment that we had already had, that precludes federal money from going to abortions. And now when they hear that the amendment passed, should they assume that that provision will be part of the permanent health care bill that could reach the president's desk? Is there a guarantee?
No, Jamie, there's not. I voted for the Stupak Amendment. I support the Stupak Amendment as I supported the Hyde Amendment in the past. But the fact is that there's no guarantee at all that this is going to make it to the president's desk. In fact, the feeling is, or there's a real concern, that when this goes to the conference committee, it'll be stripped out and it'll come back to the House without this language in it. And one of the reasons is that all of the key committee chairmen, on behalf of the Democrats who will be at the conference committee from the House, very few of them are strong. In fact, I don't think any of them could guarantee that they would support this when it comes to a vote. So there is a feeling, as John Boehner said, a concern that this is a shell game, that this was done to get the bill through the House, but once it makes it through the Senate and then at a conference committee, it'll be stripped out and sent back to the House without the Stupak language in there. So, again, we'll have to wait and see, but I can tell you that there is a real concern among many people on Capitol Hill about this.
Can you point to anything that is in this proposal? Because I know that the GOP had their own ideas of what health care reform should include. Can you identify anything in the bill as it looks right now that does have in it some of the proposals that the GOP wanted, that would secure health care in a way the GOP would support for more Americans?
Jamie, not really. I mean, there were some improvements made, but the fact is this is going to set up, with this public option, a government-run health care plan. It's going to add enormous costs. It's going to cut almost $500 billion from Medicare, which is going to particularly disadvantage those who have Medicare Advantage, which is thousands and thousands of people in my district and other suburban districts throughout the country. So senior citizens get hurt. I believe it's going to crowd out private insurance, which is going to make it harder for private insurance to compete. It's going to make, certainly it's going to be a tax on small businesses. It's going to have a real impact on them, which is the last thing we need trying to come out of recession, is to have a job-killing tax put on small business, which is the job engine of our economy.
Congressman, we're going to look at both sides of the bill, both from the Democrat and the Republican side, over the next couple of days, to say the least. So our viewers should keep it on Fox to learn more about it. And I wanted to learn more about something else, if you don't mind. I know you are a ranking member of the Homeland Security Committee. You also serve on the Permanent Select Committee on Intelligence. I know you watched, as many Americans did, what happened at Fort Hood this past week. And I'd like to ask you what information you may have obtained in your briefings or otherwise about the alleged shooter.
Jamie, I can tell you we've not gotten any official briefings at all. Certainly I haven't. I don't believe other members of the Homeland Security Committee or the Intelligence Committee have. Maybe some of the ranking members on intelligence. I know on Homeland Security we have not gotten any briefing. But one thing I am concerned about is when I see news stories saying that they are ruling out terrorist acts, that they are somehow narrowing it just to this major. And I think we should look long and hard before we close out this investigation. I think there are issues that are out there.
Well, let me mention that Connecticut Senator Joe Lieberman on Fox News Sunday has just in the last hour said that, and let me quote, he notes the statements that were made about justifying suicide bombers by the alleged shooter, and that he has a genuine concern that this was a terrorist act. Your thoughts? Do you know whether or not Dr. Hassan had contact with any known terrorists overseas?
Jamie, from what I've heard from various people in the intelligence community, I think that is an issue that should be explored very carefully to find out whether or not there was any knowledge of Hassan in dealing with people overseas, and if so, how far the intelligence committee pursued that. Did they share with other components of the intelligence committee? Did they share it with the Army? So I think this is something that does have to be looked in. Joe Lieberman is right. There has to be a full investigation. One is what was known here in the United States, but also whether or not there was any information in the intelligence community that was being pursued but was not being shared in the community. And if it was being shared, how was it shared? And was it made known to the Army? And if it was made known to the Army, what precautions were being made? For instance, how was he able to purchase a gun? These are all issues that are out there. And again, it's too early to make any decisions at all. But I think
do you have reason to believe, Congressman, let me ask you before I let you go, do you have reason to believe that there is evidence that suggests that is worth exploring, that there is a connection, that this is not an isolated incident, and that Dr. Hassan may have some connection to extremists either here in the United States or overseas?
Jamie, let me very safely say that that should be definitely explored. It should be investigated. And I believe that it's something that should be given the utmost priority, both as to what was known and how that information was shared, if it were known. And again, just from information I've received, not in any classified way at all, but just from people I've spoken to, I believe that this is something that should be pursued.
Was he watched? Was he someone that was under watch?
I really can't say, but I think that we should look into whether or not he was being watched, if he was being watched, who was watching him, and again, how that information was disseminated, if in fact he was being watched. But again, there are different reports you hear. I don't want to prejudge any of them. I'm just saying we should look into this very, very carefully, because I believe this is more than just saying he, just a random act of violence. It may have been, but I don't think we should preclude the fact that he could have been dealing with other people. He could have had contacts with others, and to see how that weighed, if at all, on this particular act.
Congressman Peter King, thank you very much for joining us.
Thank you, Jamie.